Hi guys, Dr. Sammy here with Eastwood Animal Clinic. Thanks for tuning in. Hope y'all been appreciating these videos and hopefully they've been useful and helpful for you. So something we're going to talk about today are dentals, and we're just going to talk a little bit more about the dental machine and one of the ones that we use. I have a couple different dental machines. Dental Air is one company and then our Cruce is the other one. And we'll just kind of talk a little bit about on some of the equipment that we use during our dentals here, and a lot of clinics have various versions of dental machines, but most clients have no idea what we're actually doing when we're doing a dental. So here's a little introduction, guys. So usually one of the first things we do is most patients come in with a bunch of tartar and plaque, real thick, nasty teeth built up on their teeth. Think of it as, pretend your patient's 8 years old and you have never brushed your patient's teeth in its life. How would the teeth look? You can imagine, you have a nice mental picture in your head now. But you get the point, you get what I'm trying to say. So imagine if you didn't brush your teeth for 8 years and then went to the dentist, what do you think they would see? That's my life. I see that a lot. A lot of veterinarians see that all the time. So lots of tartar, lots of plaque, lots of buildup. So we have some little tools that we knock off the plaque and tartar. On our machine, we use a descaler. So when we push on a little foot pedal down there, water comes out of here and it goes kind of like that. Just like the one that you do when you go get your teeth cleaned at the dentist. We have a lot of similar equipment actually, and a lot of people don't really realize that. But we do orthopedic surgery in the mouth, orthodontist, that's basically what that is. And to me, the way I verbalize that to clients so they understand that is, think of it as orthopedic surgery in the mouth. So basically we're literally messing with bone. It's just bone in the jaw as opposed to a broken leg, a broken foot, arm, whatever. That's the first part. So sometimes when we have these teeth, they have different roots. Some teeth have one root, some have two, some have three, and that's about the max. So it's much easier to take a one tooth root out than it is a tooth root that has 3 roots in it. So trying to pull that tooth out, it sticks a lot more and that's a lot harder. It's much easier to pull one out. Make sense? Very easy. So one of the things we'll do to make our lives easier is we have different drill bits or burrs. We have a linear one, they'll probably zoom in on these later. So it's long, kind of serrated, and it's designed to cut teeth in half. We have another one that's called a round burr, varying degrees of all of them. And that is designed to burrow away the bone surrounding that tooth root to minimize the chance of fracturing jaws, or because we got to get to that tooth root tip, and sometimes that is buried way deep down there. One of the analogies I use for a lot of clients to understand that is, think of the Titanic and the iceberg with the Titanic. So with the iceberg in the Titanic, you could see this much of the iceberg above the waterline, aka the gum line, the gingiva. But how big was that iceberg below? It was much, much bigger than what the tip was showing above the gum line or the waterline. So that's an idea of a way of thinking about teeth. You can only see the crown, the top part, not necessarily the root, and some of these roots are much bigger or have 3 roots, not just 1 root, so we use different tools. This one is the burr. Like I said, with the drill bit, don't have it plugged in so I couldn't turn it on, but it sounds just like the one at the dentist. We put one of those little bits in. We usually put it between the teeth and we cut it in half. And then we use some other tools, elevators and different things, and work the tooth out and pull it all the way out. But that's what this one's for. Usually once we get through all of that and we do some of the other things, we'll get to the polisher. And a lot of times we will use kind of a combination of different things. We have different options for our clients, and there's some that we do with every basic dental that are just included. One is called Profi Paste. Basically, think of it as like a flavored toothpaste. Kind of protects the teeth, help cleans things. We have spearmint, I think they're strawberry flavored. They get very creative, so we use that. But basically what they do is they use this little white brush thing. Think of it as a power tool toothbrush. Is basically what it is. And we put it on different attachment and put it on there. Once we've cleaned the teeth, pulled the bad teeth, Sometimes we do dental x-rays. Then we go in, polish them, clean them up, put a protective layer on them, Profi paste, sometimes a few other things like Sanos and so on. And clean them up and polish them up, and that protects them and reduces the chance of tartar and plaque buildup, or trying to slow it down more accurately. One of the other things that we tend to do is we apply a fluoride foam paste. And if you pay attention to your toothpaste bottles, most of them that say anti-cavity will have some form of fluoride in there. It's usually like 0.04% or some version of that. Depending on the company and the quality and the brand and prescription or not, there'll be different concentrations. But fluoride is anti-cavity is a way of thinking about it. So it's one of the things that we also tend to apply. And a lot of clinics will put that in there too. And it makes the mouth smell good. So that's a nice benefit. This one is just fun to play with because it shoots water and then air. And then we can mix them and get a good little spray. So anybody who's had their teeth cleaned when they've gone to the dentist, that's the one where they're spraying in your mouth and then you hear the little suction. Yeah, that's because they're doing it in people who are awake. Our patients are not awake and we have a tube and they're intubated. So we don't really have the suction part. But that's kind of the basic tools for a lot of dentals that are used and how we kind of go about some of those teeth. So a little insight on some of the dental equipment used, guys. So hope you learned something. Hope that was fun. And thanks for tuning in, guys. We appreciate you. We'll see you next time. Bye.